I love this song. Welcome back to Indie Now, friends. You know, many people have put aside routine doctor's visits during the pandemic for a variety of reasons, but ignoring your regular checkups can have some serious consequences.
That's very true, and that's why we're joined by Dr. Laura Reif. She's a clinical innovation officer for Hancock Health. She's going to teach us about what women specifically can do to keep our hearts healthy. So, Dr. Reif, thank you so much for being here with us.
Thanks for having me today.
I'm loving the red in honor of Heart
Yes.
Health Month.
That's right.
This is so important because we talk about this throughout the month of February, and it's because there are risk factors that we need to be looking for. So what do we need to keep in mind?
Absolutely. There are lots of risk factors that go along with heart disease. If you have a family member that has had heart disease in the past, that's sort of a gift from your relatives to know, hey, I need to look out for my genetics. Another risk factor can be smoking. People who are tobacco users have a higher risk of lots of health problems, but specifically heart disease, diabetes, inflammatory diseases like lupus, rheumatoid arthritis. Those can also be risks as well.
Okay, so if someone is suffering from heart disease, maybe even has a heart attack, Dr. Reif,
Sure.
what are some warning signs that we need to keep an eye out for, like when it's actually happening, and if we see those, what should we do?
Well, it's not a common fact, but heart disease is actually the #1 killer of women.
Wow.
And so that's why this program of Go Red for Heart is so important. And so some of the risk factors that we've talked about, we also can take that into what are the symptoms. And in women don't always follow the classic symptoms of heart attacks.
Okay.
The common ones, and most people will present like this, is chest pain.
Chest
Okay.
pain, right.
You'll also see people that they may be pale, they may be sweaty. But some of the other things that women will report that other people don't is indigestion, dizziness, or lightheadedness.
Yeah.
And these are subtle findings and subtle presentations, but we need to really pay attention when our family members that are female report those symptoms.
And this is so important because you know how women are. They'll be like, well, I'm fine.
Right.
Probably just need to, get
I'll
some
just
sleep.
lie down.
Yes.
It'll be better when I wake up.
Right.
Yeah, don't ignore those symptoms.
Don't
and
ignore
if you
it.
see your loved ones and they're short of breath, they're not doing what they used to be able to do, really say, Mom, go to the doctor.
Yeah.
Go check yourself out.
You need someone who recognizes that change in behavior for sure.
Trust those instincts, yeah.
Yes,
Thank you.
absolutely.
Good
We
point.
do want to talk about heart health screenings or tests that women should be sure to ask about. So what would you recommend?
Sure, absolutely. The best medicine is preventative medicine. So if you can look ahead and be able to screen for heart disease, that would be the best thing to do. See your doctor, get your cholesterol checked. In addition, we have heart scans, and that's sort of something new. Most people remember the treadmill test.
Yeah.
And all
Oh,
of
yeah.
those. We still have treadmill testing, but the heart scans are really nice because it's not invasive. It's a very quick test. We have it available at many hospitals, but at Gateway in particular, it's a low-cost test that you can have a screen to see how much calcification is in your coronary arteries. That can help you see how much cholesterol, how much plaque you have built up. If your score is 0, you're very low risk. If your score is higher, then you need to have a conversation with your doctor about what can be done to decrease that risk that's been discovered.
Oh, that's a
Making
good
those
tip
changes,
because that is
yeah.
something you would have no idea unless you got it tested.
Absolutely.
So, thank you
Absolutely.
so much for this.
Yeah, ladies, keep those hearts healthy. Thanks,
Yes,
Dr.
thanks,
Reif.
Dr.
Thank you for
Reif.
having me.
Thank you.
Appreciate it.